and we're talking on PHA 314. Title is Mechanism of Action and Side Effects of Antidepressant Drug. Introduction. Antidepressants are a group of medication used to treat depressive disorder and other mental health conditions. They work by balancing chemicals in the brain called neurotransmitter, which affect mood and emotions. Use of antidepressants has transformed mental health care, helping millions of people regain stability and improve their quality of life. Understanding how they work and their side effects is essential for safe and effective treatment. Depression is a common and serious mood disorder. It causes persistent feeling of sadness, hopelessness, and loss of interest in activities. Symptoms include low energy, sleep disturbances, changes in appetite, difficulty concentrating, thoughts of death or suicide. Causes of depression include genetics, brain chemistry, life events, and environmental factors. Antidepressants help correct chemical imbalances to relieve these symptoms. Classification of antidepressants. Antidepressants can be classified based on their mechanism of action. The first one is selective serotonin reuptake inhibitors, SSRIs. Second one is serotonin norepinephrine reuptake inhibitors, SNRI. Tricyclic antidepressants, monoamine oxidase inhibitors, atypical antidepressant, newer antidepressants. Each class targets different neurotransmitters, leading to different effects and side effect profiles. The first one, selective serotonin reuptake inhibitors. Mechanism of action is that it blocks the reuptake of serotonin into nerve cells, increasing serotonin levels in the brain. It improves the mood and emotional balance. Examples of such drugs are fluoxetine, that is Prozac, citalopram, and the side effects of using SSRI is nausea, headache, sexual dysfunction, insomnia, weight changes, increased anxiety initially. The second one is serotonin norepinephrine reuptake inhibitors. Mechanism of action, it blocks the reuptake of both serotonin and norepinephrine, enhancing mood and energy. Examples are duloxetine, venlafaxine, and side effects, nausea, dizziness, increased blood pressure, dry mouth, sweating. Then the third one is tricyclic antidepressants. Mechanism of action, it inhibits the reuptake of serotonin and norepinephrine, but also affects other receptors, causing more side effects. Examples are amitriptyline, nortriptyline, imipramine, and the side effects are dry mouth, blurred vision, constipation, urinary retention, weight gain, drowsiness. And the fourth one is monoamine oxidase inhibitors. Mechanism of action is that it blocks the enzyme monoamine oxidase, which breaks down serotonin, norepinephrine, and dopamine, increasing their levels. Examples: transcypromine, isocarboxazid. Side effects: dizziness, sleep disturbance, weight gain, sexual dysfunction. The fifth one, atypical antidepressants. Mechanism of action, it acts in unique ways, not fitting into other categories, and blocks dopamine and norepinephrine reuptake. Examples are bupropion, trazodone. Okay.
Should there be E after that N?
This one.
Before that bupropion, should there be E?
No.
No E after the N, are you sure?
Yes, sir. No E.
No E after the N, are you sure?
Yes, sir. Okay.
Check well.
There's no E, sir. Please, like this.
Okay, it's your work. I'm listening to you. You're pushing us.
Okay, the side effects. The side effect of using bupropion is the risk of seizures at high doses And the side effect of using trazodone is drowsiness, risk of priapism, that is painful erection. Then the last but not the least is newer antidepressants. And the examples are esketamine, which is like a nasal spray, and brexanolone, that is used for postpartum depression and modulates GABA receptors. Side effects are esketamine.
Right, right. That is so let's get this very pronunciation. Right. So where does it belong?
That is a drug under the newer antidepressant.
What is mechanism of action?
Mechanism of action is that it is used for the treatment resistant depression.
No, that's the indication. What is mechanism of action of the esketamine?
It modulates GABA receptors.
Modulate how? Throw more light on it.
Okay.
Throw more light on it. Okay, you didn't do specific work on that, did you?
No, sir.
Will you come back and tell us?
No.
Oh yeah, tell us. Another secret of presentation: don't mention what you cannot explain. Is that clear?
Yes, sir.
Tomorrow you may see yourself somewhere and you are rapping and you start mentioning. A question can come from that thing you mentioned and it will look somehow. So then why are you telling us when you don't even know what you're talking about? Does it make sense? You talk about what you know so that if someone is confused, you can actually help the person to explain it. So if you cannot get the means of action, okay, list others. Let's see them. List other. You said they are the new what?
Newer
Antidepressant, right?
antidepressants,
So
yes.
list them. Let's see them. So after you see them, if you cannot tell us their mechanism of action and side effect, you next week I'll give you few minutes. You tell us about their side effects. No, it's no longer part of your work. It's just for you to teach us about it.
Okay.
It's not as if you don't do it, I will not score you. But I've made the correction.
Yes,
Next time, if you are doing any presentation, please don't anything you cannot explain. Don't even add it in what you are saying, because the question can come out of it, and it's somehow that you cannot even explain what you are talking about. So you say what are their names? Esketamine, right?
Esketamine, brexanolone, vilazodone, and vortioxetine.
Vortioxetine, okay.
So esketamine.
Okay.
Esketamine, the mechanism of.
Do they all share the same mechanism of action?
No, they have their own different.
Oh yeah. Okay, you want to tell us now?
Yes.
Okay. Oh yeah, fast. You have like 1 minute to go. Oh yeah.
Esketamine is an NMDA receptor antagonist. By blocking
You have mentioned another thing. Now, what is MADA? The more you talk, the more you mention another thing. Okay, let me tell you what. Okay. You really want to finish this into the oil? Let me tell you what.
The aspartate.
Continue.
And this NMDA are a type of glutamate receptor in the brain, okay. And they play a crucial role in learning and memory, okay, and neurotransmission.
Continue.
Should I continue?
Yeah, continue the
esketamine, yes. So esketamine is an NMDA receptor antagonist. By blocking NMDA receptors, it can rapidly increase synaptic connections and improve mood.
Okay.
It's thought to work differently from traditional antidepressants, which often take weeks to show effects.
Okay. Continue.
Brexanolone.
Okay.
Brexanolone is a synthetic version of the natural occurring neuroactive steroid.
Okay.
It modulates GABA receptors, which are involved in calming neuronal activities. This can help reduce symptoms of depression. particularly in postpartum depression.
Okay.
The third one is vilazodone.
Okay.
Vilazodone combines serotonin reuptake inhibition with partial agonism, and it increases serotonin levels.
Okay.
It is used to treat major depressive disorder and may lower risk of sexual side effects compared to some other antidepressants.
Next one.
Next one is vortioxetine.
Zectin.
It has a multifaceted mechanism. It inhibits serotonin reuptake, which increases serotonin levels. It also acts as an antagonist on 5-HT3 receptors, which can contribute to antidepressant effects.
What is 5-HT3?
Hmm.
Right on the board, let's see. Mm-hmm.
5-HT3 is a type of serotonin receptor that is found in the central and peripheral nervous system.
So,
Sir?
What is the meaning? What is the full meaning? 5, that H and 3. What they represent? You must come back next week, whether I like it or not.
Sir, please.
Oh yeah, tell us what does it mean? The more you talk, the more you bring another point now, you will explain. Oh yeah, fast. 5-hydroxy what? Oh yeah, now fast. Please clap for her, please. Clap for her. I say clap. When I say clap, me clap for her, please. I am impressed, seriously. I am impressed. Man.
This is an...
It's okay. Thank you. God bless you. Thank you. Please, let's clap for again, please. All right.
So let me... Conclusion.
Okay, she wants to conclude. I can conclude.
Antidepressants are vital tools in managing depression, but they must be used carefully due to their side effects. Understanding different types, mechanism, and potential adverse effects helps clinical and patients make better treatment decisions. With ongoing research, future antidepressants may be safer, faster acting, and more tailored to individuals. Thank you.
All right, thank you very much.